In about March 2020, the COVID-19 pandemic started to hit us.
The pandemic is still here today.
To cope the pandemic, our country is currently imposing movement control orders and we are required to stay at home.
While staying at home, it is important that we take good care of our physical health, oral health, state of mind, and so on.
We, JCI Perai, are trying to make your time at home interesting and effective. We are going to feed you with knowledge, information, and fun facts.
We will be having sharing speakers who are mostly healthcare professionals, and they will share with us useful information and knowledge that we may not know.
Ladies and gentlemen, stay tuned and remember to check our Facebook page to find out more.
Come join us, be active citizens to create positive impact to our communities.
Ladies and gentlemen, see
See you soon.
See you soon.
Hi, welcome to Evening Tonight. My name is June and I am going to be your moderator this evening. Evening Tonight is an online sharing program run by JCI Perai. On selected Fridays, we are going to interview healthcare professionals and they are going to share with us useful information, knowledge, tips, as well as fun facts about our general health as well as our well-being. During this period of COVID-19 pandemic as well as movement control order, it is very important for us to take care of our general health as well as our well-being. When we talk about our general health, health includes oral health. It is very important for us to take care of our oral health care as well as our oral hygiene because our oral health is actually linked to our general well-being. What is the relationship between oral health and our general well-being, as well as the relationship between oral health care and COVID-19 pandemic? Well, today, we are very, very honored to have Dr. Diong Charng Shing, a practicing dentist, to be our guest this evening. So let us put our hands together to welcome Dr. Diong to come on stage. Welcome, Dr. Diong. Ladies and gentlemen and audience on Facebook, please like, comment, and share this video so that more people will be benefited from today's sharing. So let us begin. Doctor, can you tell us a little bit about yourself, your background, and what you do for a living?
So good evening, June. I would like to start off by thanking Keith for inviting me to this platform so that I could share my thoughts and views and some tips and tricks regarding teeth. So I'm a practicing dentist for 3 years now, and I'm actively pursuing research in the meanwhile, doing clinical studies and work. So that's back to you, June.
Okay, so dentistry, right? Personally, I'm really afraid of going to a dentist because dentists work really, really closely with a patient. Dentists work at a very close proximity with patients, and I would presume that dentists would have higher risk of infecting COVID-19 since patients don't really have their mask on during treatment. Is that correct? And how has COVID-19 pandemic affected your daily practice?
Okay, so to answer that, I would maybe try to split them into a few phases. So during the first lockdown or the MCO 1.0 as we know it, it was a utter mess. Okay, everything in the healthcare field came to a screeching halt. We didn't know what were the risks. We didn't know the mode of transportation or transmission. What were the infective rates of this new virus? It was completely new. So at that point, we were only taking in emergency cases. Cases like accidents with fractures, there might be some abscess that is caused by an infection of dental origin, things like that. But under strict SOPs, especially we had to wear a lot of PPEs or personal protective equipment to protect ourselves from getting infected and also transmitting the virus to the patient itself. So as we move along during the next phase, we tend to understand the virus a bit better. As we understand the modes of transmission, we can effectively reduce the risk of actually infecting or getting ourselves infected. That is by wearing the astronaut suit that you tend to see, or commonly known as coveralls, with goggles and N95 masks, face shield, double sets of gloves, and also hand nets and shoe nets. That is just to prevent us from getting contaminated. Imagine all that just for a simple treatment, a simple examination. As the virus or the pandemic eased up, a lot of innovations started to pour in. Dentists around the world started to share their ideas, their experiments, their creativity minds were put to work. They have actually created a simple barrier to isolate the operator, which is us dentists, from the patient itself by using simple materials like Perpax plastics and PVC pipes. So that allows us to further reduce the risk of infections between the doctor and the patient. And as we move along, more and more equipments were being bought and were being used to effectively control the spread of the virus. And at that point of the moment, we have really used this contract tracing app, which is MySejahtera, that would allow us to properly screen the patient's risk. So by following the rules and SOPs that were set by the MOH and also various guidelines by the international healthcare community, we are managing it very, very well. But nevertheless, do call your nearest clinic or dental office and ask them about their procedures so that you can know when or where can you actually go for a checkup or a treatment. Do make an appointment so that you won't have to waste a lot of time on waiting for an examination and so on. Back to you, June.
Okay, so that was quite extensive. Since there are so many procedures involved, would you consider that it is safe for patients to visit their dentist during COVID pandemic for a non-emergency treatment such as scaling or cleaning?
Okay, yes, you can definitely visit your dentist. You can just call them up and ask for their procedures, how do they screen you or what you need to prepare. So as long as the clinic or the dental office is well equipped with PPEs, and they definitely have a set of guidelines that they follow strictly, okay? So as long as they follow all those SOPs, it is fine for something like scaling or a filling or even a simple dental checkup. No worries, just go ahead and make that call, make that appointment so that they could guide you on what you can actually do or what you should do before or when you visit the dental clinic. Thank you.
Then would you say that all treatments are safe or deemed doable during this pandemic? What treatments are deemed doable or safe during this season?
Okay, so most, if not all, treatments are actually deemed doable, including extractions, fillings, scalings. As long as the clinic follows the SOPs, then it should be fine. Maybe for something a bit more invasive, like MOS or minor oral surgery, which is usually done in a hospital setting, the patient or the customer might be subjected to a swab test before they are being admitted and before they enter the operating theater. So do check or do communicate with your dental office and see what are the procedures being implemented by them. Thank you.
Okay. So let's move away from the pandemic a little bit. I understand that oral health care is linked to our general well-being. I also read somewhere that oral health care is actually linked to other serious health issues such as heart diseases or stroke. Is that true? And could you please tell us more about it?
Yes, I'm afraid so. Because there has been various research, various articles that are being published that actually links both cardiovascular diseases and gum diseases together. So until today, the complex nature of cardiovascular diseases is still rather unknown, but we could actually link the bacteria that is causing inflammation and gum diseases to inflammation of the cardiovascular system. So the keyword is bacteria and inflammation. With those two combined and a very complex nature of cardiovascular diseases, it becomes a predisposing factor to actually implicate the person and cause a lot more issues along the way. But as we know it, cardiovascular diseases are complicated by nature. So we would always try to reduce the risk by reducing gum diseases in general.
Okay,
Thank you.
gum diseases. So let us now talk about gum diseases. Tell us a little bit more about gum diseases. So what is a gum disease and how do we even protect our gum? Can we even protect our gum?
Yes, definitely. Okay, I'll first start off with the different or various kinds of gum diseases. So we have the lighter ones, the non-serious ones like gingivitis. And of course, as we move along, we have periodontitis, and there's also advanced periodontitis. So I'll start off with gingivitis. So gingivitis is actually a gum inflammation that is usually indicated by the bleeding of the gums. So as we eat, as we drink sugary drinks and so on, plaque tends to form a sticky film, okay, on the surfaces of our teeth. So plaque is actually rich in bacteria, rich in germs. So germs produce toxins. And by producing toxins, the toxins actually irritate our gums. That is where you can actually see your gums tend to swell, become reddish, and might even bleed with a simple touch or a bit of brushing. But that condition is actually reversible. As long as we properly brush our teeth, we properly maintain our oral hygiene, the situation is reversible. As for periodontitis, things get a bit more tricky. Remember the plaque that I just talked to you about? It actually continues to build up. And as we tend to neglect our oral hygiene or oral health, that plaque can actually turn into something harder, which is calculus or tartar, and also known as karang gigi. So that tough part of plaque is actually it's impossible to remove using normal brushing methods. So that would create bone loss, that would create swelling around the gums. And as that is, and even that is still being neglected and it proceeds to a more advanced stage, it becomes the advanced periodontitis. So that is when bone loss becomes imminent and your fibrous tissues around your gums starts to disintegrate. That is when your tooth starts to get shaky. It tends to shake, it tends to bleed a lot, and you have odors coming up from your mouth. So at that stage, only aggressive dental treatment might help that condition. But if there is no work being done, the doctor might have to extract whatever's left or whatever tooth is actually shaking.
Okay, so I noticed there are a lot of big words or jargons being used. So basically, there are 3 stages, right? So gingivitis, and then what are the stages again?
It's gingivitis, periodontitis, and advanced periodontitis.
And the early stages can be reversed, but not the advanced stage. Is that true?
Yeah, the early stages are reversible, okay, with proper or normal maintenance that you can actually do at home. As when you progress into the periodontitis stage or the second stage, you would require a cleaning or a scaling treatment being done at the dental office or your nearest clinic. And if you're actually progressing to the advanced periodontitis stage, it might be difficult and the doctor might have to extract your teeth if it's unsalvageable or it's deemed not savable anymore.
Okay, so enough about jargons and big words. Let's talk about something more relaxing. Let's talk about some myths and facts.
All right.
Removing upper teeth would affect one's vision. Is that a myth or a fact, and why?
Okay, so ever since my dental schooling years, that has been one of the greatest myths ever. A lot of patients actually come to me with that concern, telling me and asking me, constantly questioning me, is my eyes gonna be fine after I remove or extract my upper teeth? Okay, so the answer is yes, it's completely fine. Okay, there is no interconnection between the nerve fibers of our eyes and our nerve fibers of our teeth. Okay, because first of all, they are not interconnected, and if you can actually raise your index finger, middle finger, and your ring finger, if you place it along the side of your face, you can see how far of a distance that our nerves are actually separated. So if we actually remove the upper teeth, it shouldn't interconnect with the optic nerves or the eyesight. So it's perfectly fine to have your wisdom teeth removed.
Okay, so that's a myth, right?
Yeah, that's
okay. So another question about myth or fact. When we have bleeding gums, it is better to not brush our teeth? When we have bleeding gums, it is better to not brush our teeth. Is that a myth or a fact, and why?
Okay, so that again is another myth, I would say.
Okay.
Because if you have bleeding gums, like what I've explained beforehand, it means that there is inflammation on your gums. And inflammation is usually caused by having that plaque or that sticky film that is around your teeth is causing the inflammation. So by brushing your teeth, you would remove that layer of film. And if you could actually add another flossing regimen into your teeth brushing and also use mouth rinse to further reduce the risk of actually getting your gums inflamed. So that would definitely help with the gingivitis or the gum inflammation. So push on, brush on, and floss on. Brush consistently, brush effectively, and brush accurately. So don't stop brushing.
Okay, I have a question about brushing then. How about brushing too much? Because some people told me that if you brush your teeth too much, that itself will cause abrasions or sensitivity or even wear and tear. Is that true?
Okay, it is partly true, but due to improper brushing or ineffective brushing. Well, for example, some people, they would just jam their whole toothbrush in while holding it like a chainsaw, and it just goes zigzag, zigzag, zigzag with a lot of force. So what I've been told or what I've been taught on this is we should not use more than 3 fingers force, okay? That is the proper way of brushing. And by implementing a much more accurate way of brushing, we could actually prevent tooth sensitivity or even wear and tear. So there is nothing like brushing too much, but we would always advise brush after 30 minutes, after you eat, and not right after you eat. Okay? So don't brush immediately. Wait for at least 30 minutes. Wait for your teeth to actually go back to their normal or neutral pH.
Right.
That is where and when you should brush, not while it's still in an acidic pH where your enamel layer is actually quite weakened. Okay?
All right. So brushing after 30 minutes and don't brush immediately after food. Okay. Duly noted. Okay. True or false question. If we have no pain in our teeth, there is no need to visit a dentist. True or false? And why?
Well, I would say that's a big false, okay? F-A-L-S-E, false. It's because it's not that we dentists are trying to make money off patients, okay? We are actually trying to prevent a much more serious case from happening. For example, extractions or even infections, or even pain, prolonged pain, chronic pain. So what we actually try to encourage patients or the general public is to actually visit their dentist every 6 months, which is twice a year. But even if you're too busy, once a year would suffice. So by bringing yourself to the dental clinic, okay, you are actually preventing a lot of things from happening to your oral health. Because at the dental clinic, the dentist will have a specific set of materials and equipment to properly examine your oral cavity, which cannot be done at home, okay? And usually when you actually start to feel pain, that is when the situation has already become rather bad or worse. It's really rather serious. So most of the time when you actually start to feel pain, a lot more invasive or a lot more pricey treatments are going to be implemented to actually save or salvage that tooth or teeth that you actually have. Thank you.
Okay. How about scaling or cleaning your teeth? Does scaling or cleaning your teeth actually make your teeth thinner?
Okay. That would be, I would say that would be a very general misconception.
Okay.
Yeah, it's a very general misconception. So as we scale or we do tooth cleaning, okay, teeth cleaning, we actually remove the hardened plaque or the calculus, okay, that is actually deposited on surfaces of teeth. And those depositions are actually created over time. It's not just 1 night, 2 nights, or 3 nights. It could be weeks, it could be months. So imagine that on your teeth and imagine feeling it with your tongue for more than weeks or months. You'll get used to that kind of feeling, right? So as we move along, as we finish scaling, we finish the treatments, we remove that deposition. So we would feel that, wow, our teeth are actually clean, our teeth are actually slimmer, our teeth are actually being removed, but that is not the case. Because if you can actually see on the mirror, your teeth is still the same size, but it's just that the feeling of that layer of calculus that is stuck there for so long, we feel actually relieved by having that removed or cleaned. So it's a misconception, and yeah, it wouldn't thin your teeth or it wouldn't file the teeth away. So yeah, back to you, June.
Well, my last question about scaling is scaling painful?
Oh, definitely no. It's not painful. Because the nature of the scaling instrument, it vibrates. It vibrates at a ultrasonic level. Because the calculus that I've just mentioned, it's actually a very thick and a very strong and hard deposition. Okay, without ultrasonic scalars or ultrasonic vibrations, we are unable to remove or loosen that hard deposit that is on the surfaces of the teeth. I wouldn't say that you would feel pain, but you might feel a bit of discomfort as we gently brush or we go through with the scaling treatment. And if you have severe inflammation on your gums, a bit of pain, a bit of discomfort might manifest. But that is all good, that is all fine, because we are actually trying to help the gums recover by removing all those excessive bacteria and excessive plaque or calculus that is stuck onto your teeth. So back to you, June.
Okay, so scaling isn't painful, right?
Yeah,
okay, so I should remind myself that. Okay, any last words before we call it a night? Since it was quite an extensive session already. So yeah, any last words?
Yeah, definitely. My advice is brush consistently, brush accurately, and do pay a visit to your dentist every 6 months. Okay, and stay safe, everyone. Get vaccinated as soon as possible. Let's just hope that the pandemic ends so that we could enjoy our lives. So, and I would like to express my thanks to JCI Perai for organizing this event and allowing me to speak out and share a bit about my knowledge on this platform. And of course, special thanks and special shout out to June for being the organizing chairperson, JQ, and the rest of the team for organizing this. So back to you, June.
Well, you are most welcome, and thank you for accepting our invitation to do this sharing. It was very, very insightful and extensive, and I am certain that we have all learned something new today. Some take-home note: visit your dentist regularly, make an appointment, don't sit on a cavity or a dental problem because they may turn into something more serious, right? Thank you very much. So now I would like to invite our President Keith, President of our JCI Perai, to come on stage to give his closing speech.
Good evening to Dr. Diong and organizing chair lady, come moderator for tonight and audience. First of all, I would like to thank Dr. Diong for taking up the precious time to speak to us today on a very important topic on teeth. Your informative sharing about gum care and the importance of oral health. And we thank you for great informative sharing. So let's talk about JCI. JCI have 4 areas of opportunity or development. So the opportunity is individual growth, business and entrepreneurship, community action, international cooperation. So this evening, we are going to share about individual growth. So JCI is a platform whereby activities within junior chamber are geared toward increasing individual member personal development and helping them to unleash their full potential. Throughout various skill development courses, leadership training programs, members develop valuable skills such as goal setting, time management, public speaking, project management, parliamentary procedure. JCI members are able to develop and practice individual development throughout participating in JCI competition. This competition, including writing, public speaking, debate, and pitching competition. By participating in these activities, members are able to hone important speaking, writing, and critical thinking skills. Members also can develop themselves by attending and training skill development courses. So JCI provide members numerous opportunities to develop skill by taking parts as a committee, project OC, officer of local and national organization. By helping individual member acquire experience as decision maker, JCI contribute to the development of tomorrow communities and business leaders, thereby equipping them with necessary technique to become future leaders of the community. So back to you, June.
Okay, thank you, President, for your speech. And indeed, in JCI, JCI is a place for us to learn new things and to hone our skill. For example, public speaking skill and skill to be an organizing chairperson, as well as other skills. Okay, so now as the organizing chairperson of Evening to Night online sharing program, I shall now present a certificate of appreciation to our speaker, Dr. Diong, and this presentation is witnessed by our President, Keith Lee. President, could you please share screen so that we can all take a picture together?
Yes, okay, sure.
Okay. So let's smile and I will now take a picture together. Okay, 3, 2, 1. Okay, done.
One more, I take.
Okay.
Okay. Okay.
All right. So, ladies and gentlemen, we have reached the end of our session. We have covered a lot today. It was a very, very extensive and informative sharing session. It has been great. So thank you once again, Dr. Diong, for your time and the great sharing. Thank you, audience, for spending your evening with us. And good night, and we'll see you next week. Bye.
Thank you. Thank you.